Well, good afternoon. From the start of this pandemic, we've used every tool available to us to fight off this deadly threat. We face an invisible enemy. But if we test, we can find it. If we trace, we can track it. And if we have those two things, we can contain it. That's why we expanded our testing capacity so anyone who needs a test can get a test. We rapidly built up a network of 30 laboratories and 130 assessment centers to ramp up our testing capacity, now reaching over 20,000 tests a day in recent weeks. We worked with our public health units and other partners to build up an army of 2,000 contact tracers to follow up on each case. We're now exceeding our target of reaching 90% of cases within 24 hours, but we need to keep going. Testing and contact tracing is critical. Building this capacity will help us stop the virus in its tracks. And today, we're launching our government's enhanced case management and contact tracing strategy. This strategy will help us strengthen and support contact tracing, giving us the ability to consistently and reliably track cases of COVID-19. It's absolutely critical to have this capacity as we begin to reopen more regions of our province. And the federal government has offered us an additional support of up to 1,700 Stats Canada personnel. These are absolute pros at data collection. They speak 35 different languages, and they can make up to 20,000 calls a day. And I have to thank Stats Canada for stepping up and the federal government. As part of this strategy, we're launching a new Made in Ontario app for contact tracing called COVID Alert. I want to be clear, personal privacy was our #1 priority as we worked to develop this app. In partnership with the federal government, this Made in Ontario app will alert Ontarians and Canadians if they've been exposed to someone who has tested positive for COVID-19 in the last 14 days. The data will be anonymous and protect the privacy of the users. That was the top of the list when we looked at apps, protecting people's privacy. I have to recognize the folks at the Ontario Digital Service and our Chief Digital Officer, Hilary Hartley, and the incredible volunteers from Shopify who developed this state-of-the-art technology right here in Ontario. I really want to thank CEO of Shopify, Toby Luque, for his leadership and for donating their time to keep Canada safe. This is just one example of our best and brightest working together to find Made in Ontario solutions. We won't be reliant on anyone else. We can build anything here in Ontario. We'll have more details about the app to share in the coming days. With the expanded strategy in place, businesses, workers, and families will have the confidence they need to open their businesses and resume their daily lives. And I have to thank all our medical lab technicians, those working in our assessment centers, the hard-working people at Ontario Health, and our public health units. You're absolute champions. Thank you for everything you do, day in and day out. Thank you, and God bless the people of Ontario. Now I'll turn it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. Together, we're making tremendous progress in our shared fight against COVID-19. For the 5th straight day, Ontario has reported fewer than 200 new cases of the virus, and we continue to see a persistent decline in the number of active cases in the province. This progress is no accident. It's the result of the hard work and dedication of every Ontarian to stay safe by practicing physical distancing and following public health guidelines. While considerable, however, these efforts aren't enough on their own. Early detection of and containing new cases of this virus have been and will remain critical as we look to put a stop to the spread of COVID-19. That is why we significantly expanded testing. Now we are enhancing case and contact management. As we begin to reopen the province, the number of contacts per case is expected to increase. As they do, it's never been more important to ensure that Ontarians and public health units have the additional resources, tools, and support they need to keep themselves and their communities safe. Our new case and contact management strategy is going to help us do that by ensuring that all new cases are reached within 24 hours and all close contacts are identified early so they can get tested. And it will ensure that those cases receive follow-up contact for 14 days. It will provide our public health units with additional staffing resources and significantly improve the technology we use to track and report new cases. We are finally getting on with the long overdue work of replacing outdated systems that no longer meet the needs of public health units. We are replacing the integrated public health information system introduced 15 years ago with a new custom-built case and contact management system. Implementation of this new system will begin almost immediately, with the first wave of public health units going live as early as mid-July. A Made in Ontario app will equip the public with a new and innovative tool to alert them when they may have been exposed to COVID-19 and provide users with quick access to public health advice and next steps. Combined, these initiatives will drastically enhance our ability to detect and contain new cases of this virus. As we do, we will continue to protect the health and well-being of all Ontarians. Thank you.
Okay, we'll go to the phone line for questions.
I'm just going to, I just want to acknowledge a couple people. Before I take questions, my friends, I'd like to do a shout out to Maureen Cohen and the Cohen Foundation. They're making a $5 million donation to Conestoga College to help train more personal support workers, and that's incredible news. They're going to train 2,000 more PSWs over 5 years, and that's going to be a huge, huge help for long-term care sector and seniors. And so thank you very much, Maureen, and your family, and this one's for your mother, Frances. So thank you. Another quick shout out. My friends, there's never a time that we need more philanthropy than we do now. And I just want to thank all the families out there that are donating. I was at the Cordalucci Vaughan Hospital the other day, revealing the name, and the Cordalucci family donated $40 million to the new Cordalucci Vaughan Hospital. So again, thank you. And there's so many other people out there that are helping charitable organizations, helping hospitals. That's the true Ontario spirit. So thank you very much for that, and we'll take questions now.
Okay, first question.
Your first question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. The potential to expand contact tracing with this app is absolutely incredible, but it does depend solely on the goodwill of people signing up for the app and then deciding to send out push notifications if they test positive. And people these days are very, very skeptical of technology, not to mention it can be a bit of a struggle getting people to do the right thing. We're still seeing so many people out there without masks on. So what's your level of hope that people will really sign on to this?
Well, I really hope, because there's really three parts to this. If we want to protect Ontario, we want to protect our families and the people of Ontario. 3 areas: health, which includes PPEs, the ICU capacity, and then testing. Testing is absolutely critical. And the third part is contact tracing. And I'm so pleased today. I really am. I just want to thank the leadership of Dr. Williams and Dr. Dirk, as I joked around the other day, but he kind of liked that Dr. Dirk. So Dr. Dirk and Matt Anderson and the whole team, it's like a well-oiled machine right now, moving. Everything's come together. At the beginning, there was bumps in the road, but man, I'm just so impressed with the team out there. And you're right. If we don't have the cooperation of the people of Ontario, we put ourselves more at risk. So it's a simple download the app, and it's 100% private. That was our number one issue right at the get-go. We said there has to be privacy, because I know how important that is to people. And there's 100% privacy when it comes to this app. And we're just going to continue promoting it. And we need people to download this app. It's going to protect us. It's going to protect your families.
Thank you. And my follow-up, why now and not earlier? Is it because the threat of a second wave is becoming more significant, so the province is getting this app in place and getting ready for that second wave in the fall?
No, not at all. Our digital team in Ontario worked with Shopify. Shopify actually donated some of the brightest people they have at their company, and we worked hand in hand with them. So this has been an ongoing process. Privacy was the #1 concern. They nailed that, and it's going to be an app that everyone in Canada is using. They've adopted it over at the federal government, and I want to appreciate their cooperation. And I just think this is amazing if everyone uses it. But everyone's cooperated right from day one with COVID-19. So let's all stick together and keep moving forward, because it's going to protect us. And we have the other systems just going like a well-oiled machine. Now we need the contact tracing, and we can't do it without your help.
Next question.
Your next question comes from Kathy Tomlinson with the Globe and Mail. Please go ahead.
Hi, Kathy.
Hi, Premier. I'm hoping you'll respond to a question about the opioid crisis.
Okay, we'll give it a shot.
An investigation into workers' compensation that we published today found that many cases there were injured workers who became addicted to opioids after being sent back to work by Ontario's WSIB too early. And they were still injured, still in pain. They took opioid painkillers to cope, and some died of overdoses or suicide. So what, if anything, would you like to see your government do to address this?
Well, I'm going to hand this over to the Minister of Health. Thank you.
Well, this still is a significant concern, mental health and addictions issues. We want to make sure that we can help people to, first of all, not become dependent on opioids, but if they are, to provide them with the assistance that they need. We introduced our roadmap to wellness, our help for people with mental health and addictions concerns just before the outset of COVID-19. We are going back to that now because we know that this is going to be accelerated, that there are going to be more people with mental health and addictions concerns resulting from a lot of issues, partly from being inside for a long period of time, isolated from friends and family. Sometimes it's financial hardship that they've lost their jobs and they don't have any income. So we are looking at bringing that forward once again to make sure that people can have the supports that they need, anticipating an extra response and need coming from COVID-19.
So it's not COVID-19. If I could just have you address the more broad problem of injured workers who become addicted to opioids because they're in pain. And many people told us, and we looked at hundreds of cases across the country and many in Ontario, where they went back to work too early, and that was because the WSAB expected them to, and they took opioids to cope and then became addicted, and some have died. So what would you like to see change in that particular system, or what can you change in that particular system? Please be specific.
I think that it's really important that we all expand our knowledge of addiction to opioids, how people get into that situation, how it can happen to anyone. From an injury when they're in pain, where they start taking opioids to deal with pain, from the prescription to the continued use of it. I think there's still a lot that we have to learn. That's what we're hoping with our roadmap to wellness, and that will help inform us in many respects, including with respect to WSIB.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Yes, hi. Premier, your government has put out a notice saying that you'd like to try to get the legislature to approve an extension of the state of emergency.
Yes.
And in the note that was sent out, it was said that you're hopeful that this will be the last extension of the state of emergency. I wonder if you could clarify, though, how could you continue to have restrictions on things like large gatherings, which your government has indicated would be canceled for the foreseeable future, if there isn't some sort of emergency legislation power?
Yeah, well, that's a good point, Mike. How it works, and hopefully this will be the last time. Anything we take off, any orders we take off, we can't put back on, but the ones that are in place can continue moving forward. So that's how that works.
Follow up?
Okay. Yeah, on another note related to long-term care, there are these significant restrictions on people going into long-term care homes, and you've had situations where family members have, before the pandemic, provided essential care to their loved ones in long-term care homes. Should the province be doing more to make sure that these family members are able to get back inside facilities to help care for these seniors?
So we're as you know, we're moving forward on that, but our number one priority, Mike, is to protect the seniors there in the long-term care. It's absolutely critical, or seniors residents, and we just don't want another outbreak. We're finally getting our arms around this, and they're doing a good job, but we just can't have a flare-up with people coming in and coming out. So we're being cautious and having one family member meet their loved ones, and then I guess they can take turns doing that on long-term care.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. I'm sure I heard you and the Prime Minister say that the more people that sign up for this app, the more effective it will be.
Yes.
Is there a magic number? Is it 60, 70, 80% where it will be the most and truly effective?
Well, I'll pass this over to Dr. Williams.
So our federal counterparts were looking at the aspect and the use of this, looking at other jurisdictions that have tried other apps, and to see what is a core metric that is necessary to show its effectiveness. The actual number isn't there yet. It's an adjunct to our case contact management. So we're really interested in driving forward, as the Premier said, pioneering this in Ontario and seeing how the impact it is, and really engaging our Ontarians, as they have, as the Premier said, all along with our steps with the stay at home, the distancing, the hand hygiene, now into the social gatherings and into the social circles. So all along, Ontarians are engaged, want to be engaged, and this is just another tool, and we really want to understand how effective this is going to be as we launch it shortly.
Okay, thank you. And I'm not sure, Premier, if you still want Dr. Williams to answer this question, or maybe I could hear from both of you. Yep. Other areas that do have an app, do you have any sense of what the buy-in is and what percentage of the population is downloading the app? And have you done any polling to see what the interest would be versus the concern for privacy?
Well, first of all, I can just tell you the numbers. I believe out in Alberta there, they were, I think it was 11%, somewhere around there. But I'm going to pass this one back to Dr. Williams. Thank you.
So there are some that are used in Canada thus far. As the Premier said, in Alberta, they've had one run on that, and we're looking at their data to see how it's showing over time. It's never just at the moment. It has to build up and escalate and get its usage up and the public's adoption of it. The other countries have tried other apps, and some of those have been tied to different functions within government, and I think, as the Premier noted, one of the things we really want to address is that the concern about the public for their privacy, and this is obviously a big thing, and it's important to the public. And as the Premier said, this is of primary importance in our time in selecting with this app, that it would ensure and continue to do that in that regard. So these are the areas we're broaching into, and we want to see how that works as compared to some of the other countries and jurisdictions. But we're all learning from each other. This is a new thing, and we want to see how the public embrace this, and we can utilize this to best for their protection and to get our numbers right down and beat COVID-19, as the Premier said.
Next question.
Your next question comes from Emma McIntosh with National Observer. Please go ahead.
Hi, Anna.
Hi, Premier. Thank you for taking my question.
Well, thank you.
This week, your government restored some environmental protections that it suspended in April. And I know that the government has released some of the changes that it made while those protections were suspended, but I'm wondering,
Are you able to tell me if the government made any other changes related to the environment that haven't been disclosed?
Not right now. There's always changes. Everything's on the table. We've always, one of our highest priorities is protect the environment. And we're going to continue doing that. That's going to be a high priority for this government. I think we've shown that since we've been in office. We're doing everything we can. We have a great minister, Minister York, a very smart individual, so he's doing a great job. But again, everything is on the table right now. We'll always, by the way, when I say that, our top priority is protect the environment. That's, I'll give you an example, the green belt. We said we aren't going to touch the green belt. I will never touch the green belt. Simple as that. Ever.
Follow-up?
Thanks, Premier.
Thank you.
Now, some of the opposition members have called for your government to commit to releasing a full list of every single environment-related change related to COVID-19 or otherwise that your government made during this period when it didn't have to disclose changes made to the environment. I'm wondering if you can commit to doing that.
Well, we've been pretty transparent all the way through this, so we have no problem. Anything that's put out there, people will know about it. And that's how we're going to continue moving forward.
Next question.
Thanks, Premier.
Thank you.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Alison.
Hi, Premier. So much of the spread of COVID-19 that we've seen in Ontario has been in long-term care homes and other congregate living settings where people may not have state-of-the-art smartphones. So are you concerned that that is going to limit the usefulness of this app?
Well, again, Alison, I'm going to pass this over to Dr. Williams. Thank you.
The people in the congregate settings and the long-term care homes, those are outbreak situations, and they are confined, they're in those locations. The risk that we saw with long-term care homes was staff and other people bringing it in from the community. Sometimes, and most of the time, they either thought they weren't infected, they were unaware that they might have been in contact with someone. So the app is more appropriate for helping them to be aware if and when we open up even more visitation, so that that doesn't occur again and there's not an inflow of infection into these homes, and where susceptible individuals would be obtaining the infection and suffering morbidity. And unfortunately, we've seen the long-term care homes mortality as well. So it's more for the people in the community that they do not are alerted, and they would not bring it in and harm those individuals.
Thanks. And my follow-up, I don't know if the Premier or maybe the Health Minister wants to take this. I see that about 97% of contact tracing, the target to get people within 24 hours, that target is being hit about 97% of the time. So is this getting ready for a second wave in the fall?
Well, before I pass it to the Health Minister, I just, again, I want to thank the people. 97%, I always like getting 100, and we'll get to 100, but they've done an incredible job to make sure they contact people within 24 hours. And thanks to the people of Ontario, everything's coming together now. And, well, believe me, we'll never take our eye off the ball for a second. We'll never take our foot off the pedal for a second. But it just feels good with the cooperation of all the governments and the people coming together. That's the only way we're going to get through this. That's the only way if people, download this app. It's like a protective shield around us to a certain degree. Not 100%, but it's more of a protective shield. But I'll pass it over to the Minister of Health.
Well, 97% is good, but we do want to get to 100%, and that's what we're continuing to work on. But I think it's really also important to note that as we've been doing case and contact management, tracing throughout since the outset of COVID-19, we've been dealing with systems that are out of date. We need to update them. We need to make sure that they're modern, coherent systems that work together. So right now our laboratory system isn't working with our public health system. We need to connect the two of them so that information can come forward immediately, so you don't have to rely on faxes anymore, which sadly are still around in healthcare. So we want to modernize our system at the same time as we increase the case and contact management strategy because we want to be ready for a second wave, of course, but we want to make sure that our systems are modern and appropriate for Ontarians and that we can react quickly to any case that presents itself to us.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. I'm just wondering, maybe for Minister Elliott or for Dr. Williams,
Sure.
What is the modeling telling you right now about when we could expect a second wave?
Boy, that's a good question. I'm going to leave it up to Dr. Williams or the Minister.
So, Rob, it's a good question. We've been asking our modelers, and part of it, we said it before, it's always based on the latest information. We have some international models that look at when the second wave might or could be. We've had some theories around why it would occur at certain times, but it really depends on the epidemiology of your constituency, of your province, or your country. And so we're asking at the federal level, as we've seen our epidemic curves move in different ranges, how would that look, how might it look, and asking our modelers to say, can you update us on that with the latest data? So they continue to keep addressing that and altering that, as they did before when they were predicting if we did not take steps, we would be closer to a situation with high levels of overwhelming of our hospitals, but that didn't occur because Ontarians, and with the systems we put in place, we flattened the curve on that. I still think it's possible that by working hard at this in the summer and we do all the right things in the right way, we could start working at flattening a second wave. I don't know if we can eliminate it, that would be idealistic, but I think we can do that, and we're asking our modelers, what might we do, what should we do to ensure that we would face that and deal with it as best we can, if not, avoid it. But we want to ask them that when they update the numbers.
Okay, and as a follow-up, the 11% adoption rate of an app in Alberta, even in the early days, sounds really low. How are you going to convince people to do this, and how much of a head start would this app give someone on a notification? For example, if I was on it today and I got a ding on my phone that said I've been exposed to somebody, how much faster is that going to be than if I'm waiting for a call from public health?
Well, again, I'm going to pass it back to Dr. Williams in a second, but it's so important to have this app. If I go back to the three areas of the health, we're very well prepared now on the health side, and the testing is critical. So if we can test it and catch it, then we can contain it a lot quicker. And this app is going to help us do that. So it's really, really critical that people download the apps, and we need a strong advertising campaign to go along with that. But I'll pass it back to Dr. Williams, and thanks, Rob, for the question.
So one of the challenges we've had in our case contact management is when we're asking people to recall, did you have a contact or a close event 7-10 days ago? And a lot of them are saying, I just can't recall. And what you've asked there is a very good example that if you had something that prompted you after and said, oh, and you would make a mental note of that. So then you would start to monitor yourself a little bit better. And if you're asked by public health officials, you could say, I see on my app it was this day and that day, so it can give you some assistance. It's those prompters that we want people to remember. Where are the places that you wear? The physical layout may have been a facility or a store. It may have been with some people in a group in a congregate setting that you remember 7, 8, 9 days ago, now that you have symptoms. And only things that would help you, like apps, that would say, I remember now, I can look up, I recall it, and it prompted me at that time, and I remember the details, much like sometimes with police investigation, they say, can you remember? And you say, I just can't recall what the color of the vehicle was or whatever, I just wasn't paying attention. If something prompted you, you would probably have made a mental note. So this is going to help the people make mental notes and do a better job at their part of case contact management, because the better you're prepared, the better we can do our job, and to limit any spread and keep it eliminated and down to zero in Ontario.
Thank you, everyone.
Great. Thank you, everyone.